To speak to a lady who is in Washington, D.C., that is Johanna Leblanc, who is an analyst in matters national security as well as foreign affairs. She is a legal analyst there. If you can hear me, Johanna, good night. I'm confused because here it's very early in the morning, but I understand that in Washington, D.C., just before midnight. How are you doing?
I am doing well. Good morning, Sam, and to everybody in Republic of Kenya. I'm doing very well. Thank you for having me on.
Right, and we just took a look at the numbers that are in the U.S. You're talking about 336,000 people that have tested positive of this virus. Just a few weeks ago, these numbers were very negligible. What would you attribute this rise to?
You know, first and foremost, Sam, I would like to say my thoughts and prayers are with those who have been infected and impacted by COVID-19 in the Republic of Kenya, as well as all across the globe. And in addition, thank you to our healthcare professionals who are at the front of this global health crisis and putting their lives at risk each and every day to protect us. But as it pertains to your question, you're right. Our numbers are extremely high. As of today, we are at over 300,000 people are infected with the virus, and over almost 10,000 deaths. Mm-hmm. Now, one can argue that the United States is leading in terms of the infection rate, but that is assuming that China has released accurate data in terms of fatality as well and infection rate in China. Because the reality is, if we can go from 84 cases in March to over 300,000 today, in the United States, a population of roughly 300 million, whereas in China, the population is 1.4 billion, right? And to know that there are only roughly 3,000 deaths, one has to wonder, are those numbers really accurate? But what I can tell you is that the United States has never dealt with anything like this ever since the Spanish flu. We know SARS, which happened not too long ago, but it only impacted Southeast Asia and obviously South Korea. So a lot of those countries already have infrastructure in place to a certain extent on how to respond to a global crisis, a global pandemic, whereas in the United States, we were not expecting this. And I think that our leaders are doing the best that can be done under the circumstance. And in fact, the Trump administration recently passed a $2 trillion economic stimulus package to address this crisis. Okay.
And Johanna, I hear you sort of doubting the numbers that have been shown, posted by China, but I look at the number of tests. In the U.S., at least 1.7 million people have been tested. When I look at the data for China, I'm not sure I can find that. Why would you feel that China might be understating the numbers, yet they have been with the virus for longer? Maybe they have learned a few lessons.
That's very possible. But, again, if you look at China's population, right? China's population is, again, 1.4 billion. And when we see the rate at which this illness is impacting individuals, one can only assume that perhaps there are some flawed information being put out there to the public. And I think the global community, the world, should be stressing upon China and asking for additional data and additional information to be provided. Because we are in this together. And China, because our economies are interconnected, when China sneezes, the rest of the world catches the cold.
Okay, and Johanna, so back to your country, because when you look at the deaths we are reporting about, let me just say that the total deaths are 9,619, or that could be higher. What has gone so wrong? Because just a few weeks ago, we used to see your president saying that it will pass. It's sort of, he's been accused of downplaying it. Do you think this could have led to the situation that we have now, or did the states mismanage this pandemic?
Well, one of the ways to reduce infection rate as highlighted by CDC and the World Health Organization, is by social distancing, right? And in the United States, it's a democracy. Things don't happen as fast as they can happen in a place like China, because as we know, in China, if the government orders everyone to stay home and stay indoors, and you break those orders, there will be some serious consequences. Whereas in the United States, there's a separation between the state and the federal government. Things don't happen as fast as we would have liked in a democratic society. But what I can tell you is that our leaders, for example, I think the entire world have been watching Governor Cuomo of New York City, and he has done a phenomenal job in terms of putting certain restrictions in place so that folks can stay indoors. And not only him, also governors in other states and mayors. You have the District of Columbia, Virginia, and Maryland, which have essentially closed all non-essential businesses and have asked individuals to stay indoors. I think some people are obviously taking heed to that and they are doing the right thing, but there aren't severe consequences if someone were to violate that kind of policy. And the federal government cannot just implement a policy where it orders the entire country to stay indoors. It does not work that way in America based on our Constitution, because there is a separation between state and the federal government.
And so do you think that separation and understanding of separation of powers might have cost the Americans? Because I'm looking at a state like the New York City, and of course the governor there has been very vocal in daily briefings and telling the people what they need to do. But 122,000 cases now, don't you think that's slightly a bit high? Maybe there was something that could have been done differently. What's your opinion?
Obviously, I think that, again, in a crisis like this, I don't think no country is fully prepared. But what I can tell you is that I hope that the rest of the world is paying attention and that they are putting together strategic plans and they're putting together offices and institutions to be able to properly respond to those types of disasters. And I think when SARS happened, right, which had a fatality rate of roughly 9%, experts said it's not a matter of when we're going to have another outbreak or another pandemic. It's a matter of when, right? And we're seeing it right now. So I think that governments are now working together and with various institutions, and their institution of the Ministry of Health, and obviously in Africa, and here in the United States, DHS and other leading organizations, to ensure that we have a plan in place if this were to happen again, because it's not a matter of if, it's when.
All right. And so looking at the response that you've seen, obviously we would consider the U.S. as pretty advanced when it comes to matters health. But what are those lessons that you think, of course, we're looking at the numbers and looking at ours, we think that we're at a better place. But what lessons can we learn so that we do not find ourselves with the numbers growing in such an exponential manner?
First and foremost, what I can tell you is that, unfortunately, in the United States, everyone does not have access to health care. And the last time I checked, only 27 million people rather in the United States does not have health care. And as we know, with this virus, it impacts mainly people who have already a compromised immune system, right? And also those who are of 65 years of age and older. So that means the people who historically have not had access to health care are at a much greater risk of dying from this infection versus those who've had access to health care. So this is a call to governments all over the world to strengthen their healthcare system and to ensure that people have access to universal health care. It is a human right. The ability to be healthy, or at least to be able to access a doctor in times of need. And I know Kenya has its own challenges when it comes to the healthcare system not being properly available to all of its citizens. But another note that I would like to make is that, to address this crisis, the United States government has passed a $2 trillion economic stimulus plan, which would, one, provide additional support to the healthcare industry for ventilators, equipment such as gloves and also other types of gears that are needed. And also people who have lost their jobs will be able to file for unemployment, right? I'm not sure if you're aware of this, but over 6 million people in America have filed for unemployment. So there's going to be a huge economic implication as it relates to this virus. And also the United States government will issue a check of $1,200 to those who are qualified and up to $3,000 for families. So there are some things that the U.S. government has done to respond to this crisis, and we're doing what we can here, and everybody's doing their part, staying home and so forth.
All right, I hear you clearly, and talking about the $2 trillion that you're talking of, how sustainable, for how long can you sustain this as a government?
So another thing that the government has done to address to this crisis is that for individuals who have mortgages, who have to pay their rent, right? Because as we know, a lot of individuals have been laid off, especially those individuals who work in the not in the healthcare sector. I'm sorry, in the hospitality industry, and so many other industries have been laid off, and they're unemployed. But those bills still have to be paid. So under this economic stimulus package, those workers will receive relief and not have to pay rent for up to 6 months, and their landlords will have to work with them rather. Okay. But you're right. Is this really sustainable? The question is, when will we be able to go back to what our normal was? And I don't know if we'll ever have a normal. I think this is going to be our new normal for a very long time. So the question is, how long would it take for us to fully contain this virus so that people can go back to work and be productive members of society?
All right, that's very interesting that you should ask whether we'll ever go back to normal. We're also asking the same question here because we have to do things differently. But now, as we conclude, on a normal occasion, the African countries would look up to the U.S. for assistance or maybe for collaboration in fighting various issues that may happen. But at this time, we find ourselves that everyone is fighting the same problem. I don't know if there are any considerations for the African continent or for the rest of the world that the U.S. supports in such times.
The reality is we are all in this together, and I say this, and I mean this sincerely. United we stand, and divided we fall. And in spite of the United States dealing with its own challenges, the U.S. still has a responsibility as the leader of the free world to provide assistance to other nations in time of need, such as this. Yes, the challenges are dire here in the United States, but the challenges can be a whole lot more dire depending on where you are in Africa. As we know, when it comes to the notion of social distancing in the United States, for some of us, it's possible, but but at the same time, it can also be challenging. But when you're dealing with developing nations where poverty is at an all-time high, or where people live in abject poverty, it can be a bit challenging to tell folks to isolate, to not leave your home, because now it's a matter of, if I leave my home, if I don't leave my home, I will probably die of starvation, right? Or if I leave my home, I will die of coronavirus. Which one should I pick? And that's the reality for so many countries all over the world. But in spite of our challenges here in the United States, through the bill that passed recently, the CARES bill, there has been over $600 million appropriated to the State Department as well as USAID to provide international humanitarian aid to countries all over the world. In particular, some of our most vulnerable countries, such as countries throughout the continent of Africa. So right. I implore on the Kenyatta administration, which I'm pretty sure they're already doing, working with the U.S. Embassy in Nairobi or wherever it's located in Kenya, to ensure that some of those aids are able to be available for the people who desperately need them.
All right. Thank you so much, Johanna Leblanc. Of course, she's a legal analyst in matters national security as well as U.S. foreign affairs. Thank you so much for joining us. And I think we just wish you a good night. I mean, any final words?
Thank you so much for having me. I just implore everyone to stay home. I know it can be a challenge, it can be tough, but we're in this together. Our societies are so interconnected. When you stay healthy, it's better for the rest of the world. So stay safe, Kenya, and I look forward to connecting with you on social media.
All right. Thank you so much, Johanna, and good night.